the show, don't buy your morning latte. Make your own with Sophie Giuliano. Less money, more delicious, and healthier.
Listen, listen, quiet, listen, he calmed down. He was a little antsy, now listen.
Yeah. He's listening to this music. Look at that. Night terrors can be a traumatic experience for dogs. One of our producers here on our staff, Jessica Robertson, has brought her brother's dog, Danger Pants, to us. And Danger Pants, a peculiar name to say. And there's a whole story behind that we will leave behind, but we'll move forward. Danger Pants suffers from these night terrors. Helping us out today is veterinarian Dr. Courtney Campbell.
Thanks.
You know, before we get into this, let's share with our audience a little bit about what this looks like at night when you're home and Danger Pants is experiencing. Yeah. Let's take a look. That has gone on for almost 5 minutes. Doctor, welcome back to the show.
Thanks for having me. It's a delightful subject to talk about, but scary all at the same time.
Yeah.
So.
What is Danger Pants experiencing at that moment? And other dogs who have
Well, it looks, for all intents and purposes, like he's having a nightmare. And a lot of times people say, well, Doc, do dogs really have nightmares? And I think to understand what a night terror is in a dog, fundamentally you have to understand that dogs dream all the time when they're asleep, just like what people do, except during R.E.M. sleep, your body's paralyzed. So you're able to dream, or rapid eye movement sleep, your body is paralyzed. Well, what if that paralysis of your body is incomplete? Or what if it fails altogether? Then all of a sudden you begin to act out on those dreams. You begin to have a movement that's actually correlated to the dream content you're having. Happens all the time in people too.
Sure.
How long has he, I'm sorry, go ahead.
I was going to ask Jessica your experience with.
Well, you know, he's done this since he was a puppy. I mean, he was a stray. We found him on the side of the road. He'd been abused. He'd shown signs of abuse. And I honestly think that he might be reliving some trauma. The content of his dreams might be different from what he's experienced, but I think it's about the trauma.
How frequent?
Yeah, how many times a night does he have these?
He has these 4 to 7 times a night.
He wakes you up that 4 to 7 times a night?
The most he's ever had is 13. They vary in frequency, they vary in intensity. Sometimes it's 30 seconds, sometimes it's 7 minutes. We brought him in the bed with us because we could calm him down easier if he slept with us.
So what is causing this kind of behavior?
There could be a bunch of things that cause it, but the first thing we want to make sure is that's not a seizure. Once we know that that's not a seizure, then we can start to categorize this. Has this happened ever since he was small, or is this a new thing? If it's a new thing, sometimes it's a harbinger for something that's actually happening, like liver issues or heart issues, or sometimes just normal age-related changes in the brain. So
Well, how do you know if it's a seizure?
that's a great question. And one question that a doctor's definitely going to want to ask you is, how easy is it for you to wake him up? What does he act like as soon as he wakes up? Because a seizure, it's hard to get a dog out of a seizure, and usually when they wake up, they're disoriented. Danger, as vicious as he looked on that video, he was a sweetheart as soon as you woke him up. He's essentially back to normal as soon as you wake him up.
So you can rule that out? You can rule a seizure out?
You can, I would talk to your veterinarian, but they're gonna ask you some key questions.
Like what?
1, is he salivating all the time when he's having these episodes? 2, how easy is it for him to wake up, and does he act totally normal? Because if he does act totally normal, chances are this is a sleep behavior disorder and not a seizure.
So how do you begin treating something like this? If she brings her dog in, you can't interview the dog.
No, you can't.
What do you
so
do?
I think Sleep behavior disorders has gotten a lot of research in both the animal side and human side. And the way that we treat this is start first with a homeopathic approach. Try things like melatonin or valerian root, or sometimes a thunder shirt, which gives your dog a constant embrace so it feels less anxiety. And sometimes actually playing a little bit of pet acoustics or soothing music can help. You know what I mean?
Well, before you go, you mentioned valerian root and valerian root, and what was the other thing?
Melatonin, yeah.
But shouldn't you check with your vet first to find out how much to give them? Because you can, those things can be bad for dogs too.
Absolutely. Check with your veterinarian. And Danger Pants has had good blood tests. He's had x-rays. Sometimes we can go as far as an MRI of the brain, but always talk with your vet before giving any pharmaceutical, even if you think it's homeopathic. But always have a conversation with your vet first, because a lot of these dogs can benefit tremendously and get restful nights of sleep.
If that doesn't work, what's our next step?
Well, if homeopathics don't work, if the thunder shirt doesn't work, melatonin, valerian, then yes, we have pharmaceuticals at our disposal that can help, like potassium bromide. That's not something they use a lot in human medicine. They use things like Klonopin or other Valium-type drugs that really just allow pets to just sleep through the night. But don't ever give your pet medications at home. Don't do that.
Well, don't they have side effects like humans have side effects from these as well?
You're right. We've all seen those commercials where side effects are like the half of the whole commercial about the medication. But I've seen dogs on these medications for a long period of time with almost no side effects. So you have to be cognizant of the fact that these can cause side effects. But for the greater majority of dogs, like Danger Pants here, are totally fine.
I've had dogs my whole life.
Right.
I've never seen this kind of behavior from mine or any others.
Sure.
Is this a prevalent thing? Do we see this a lot?
It's not totally common. What is common is everybody's seen their pets dream at home. Everybody's seen them laying on their side, twitching, maybe yelping. That's not a problem. But for Danger Pants,
What are we going to do for him?
yeah, we're going to start him on some medications, and we're going to do that really, really soon, because he's tried the pet acoustics, he's tried the thunder shirt and some other homeopathic, and it didn't work. So this is pretty rare. His signs are very dramatic, but we're going to get him some help.
Can we check in on him in about 6 weeks and see how he's doing?
We're going to come back for an update.
Oh,
Let's
good.
do that.
Okay.
Good.
Right, Danger?
Okay.
And you
All
get some
right.
sleep too.
Yeah, absolutely. She's having nightmares now, too.
More information on this topic at hallmarkchannel.com/home and family is the website you can visit, or we invite you to follow Dr. Courtney Campbell on his Twitter at Dr. Courtney DVM.
Thank you, Doctor. Always nice to have you here.
Wonderful.
Thank
Good
you.
to have you.
Thank
Good to always.
We love
Pleasure,
having
pleasure,
you.
pleasure.
Thank you, Jessica. Coming up next, actress Deidre Hall is going to join us in the kitchen. When we come back, we're having one of her very favorite recipes. Hey, Deidre.
Signing.
She's signing.